Your healthcare is at risk. Historic cuts to Medicaid, imposed on us last year by the federal government, and new rules designed to kick people off of their health insurance will wreak havoc at hospitals across California and jeopardize emergency services that we all rely upon. In Santa Clara County, we are treating this like the crisis that it is. We started last fall with the passage of Measure A. With your help, it should secure $330 million annually for essential healthcare services. It was a huge victory, and one I don't take for granted, but it only solves about a third of the problem. And without more resources, we are likely facing the threat of hospital closure once again here in Santa Clara County when the full federal cuts kick in 2028. So where do we go from here? First stop, Sacramento. Pushing back on H.R. 1 can't just be left to local communities. It's going to take a statewide strategy and statewide leadership from our legislature and governor to protect healthcare services for all Californians. Whatever we can't fix at the state level is going to leave local communities with very few options. Our county is already cutting hundreds of millions of dollars in healthcare services, even with Measure A funding. And without more support from the state, we're facing a $700 million shortfall in 2028. Just to put that in perspective, that's more than the annual budget at Regional Medical Center, O'Connor Hospital, and St. Louis Regional Medical Center. So what can the state do? A lot. It can start by directly funding safety net hospitals. These hospitals, which include our 4 county hospitals in Santa Clara County, constitute just 6% of hospitals statewide, but they provide more than 50% of our trauma and burn care and train nearly half of our new doctors each year. Simply put, we don't really have a functioning healthcare system in California without strong public safety net hospitals, and losing them would be an unacceptable risk to public safety. But that's exactly what's going to happen without more support from the state, including here in Santa Clara County. So what can you do? Please call your assembly member or state senator and tell them to fight back against federal healthcare cuts by prioritizing solutions in this year's state budget. And stay in the know by following us at Valley Health Foundation.